Care Answered provides patient advocacy and healthcare coordination. And what that means is we help navigate our clients through the healthcare system in their most challenging times. When they receive a diagnosis that is catastrophic or chronic, they have a health decline, they need to go into the hospital, they're coming home from the hospital, they're going into a rehab, they're coming out of a rehab, or they need care in the home, or they need to receive the benefits that they've paid into to provide the care that they need. I am the founder and CEO of Care Answered, I'm very proud to say. We started up about 7.5 years ago. And the reason that I started Care Answered is because of the need that I saw both professionally and personally. When there are gaps in the healthcare system, when people are not able to navigate or understand their options and choices, the effects are detrimental and deadly. So it was from that understanding of being a family member as well as a professional advocate that I realized that there needed to be more. We needed to be able to assist people, especially those who are older adults and their families, in navigating that healthcare system effectively so that they could access their best care. Hero is a really big word for so few letters. I don't know that I could apply it to myself, but I'm happy to accept it for my clients, for those before me, for my family and friends and colleagues, and those working in the front lines of our healthcare system. To accept it means so much to me, and it's so meaningful for, again, all of those clients and people that I haven't met that are trying to navigate through the healthcare system, for them to know that along with my other honorees, there's a place for them to go. There are answers for them. There are options to access their care. In the work that I do, it's very fulfilling, so I feel like it's giving back to me. But I also, within this pandemic, I started a webinar series because people needed to access all the different information as well as the providers that were available for them, whether it came to people that owned a business or people that were facing a healthcare crisis or feeling alone and isolated. And I brought in a lot of colleagues that are experts in their various fields to bring that information to anyone to access it. So I really feel that was very beneficial to me, as well as from those that have seen the webinars, and I continue to hold them because the need is always there for information. I am a patient advocate because, like our vision, I believe everyone should be able to easily access the care that they need. It should be a right that everybody has, and it should be easy, but it's not. So that's why I do what I do. I want to have everybody have a wonderful experience, a healthcare experience, knowing that they are cared for, knowing that they are aware of their options, not wasting time, valuable time, to get the information that they need. That's what I hope for all people, and that's what we work to do for all of our clients. I just want to add that the healthcare inequity is something that we saw so much during this pandemic. And it's always been, unfortunately, and there's implicit bias that we all, as a healthcare community, I know my honorees have worked really hard on this, and it's continuing work. It's never going to end. And so I hope that we are informed now, but to move forward, to put these ideas that we've now learned into practice to make healthcare equality true.